So let's begin by looking at hypertension. And this is high blood pressure. And this will increase with advancing age in terms of how frequent and the incidences that will occur. So this will also increase the risk of cardiac diseases, kidney diseases, and stroke. And there's two classifications. We have essential and secondary hypertension, where essential or primary hypertension is a result of complex and poorly understood mechanisms at this point. Whereas secondary hypertension, though, is due to a symptom of another disease. And so this could be like kidney disease or cardiovascular disease, such as heart block and arterial sclerosis. Could be caused by nerve disorders, such as an increase in intracranial pressure. And then also due to endocrine disruptions, where we have an increase in aldosterone due to an increase in salt retention. So first, let's look at essential hypertension, where most or majority of people fall into this category of hypertension. And so this is difficult to determine because blood pressure is directly proportional to cardiac output and total peripheral resistance, where one or both can be increased. And so these can involve any of the following. So we could have an increase in salt intake that's coupled with a decrease in kidney filtering ability. And this could be due to an increase in ADH secretion, an increase in water reabsorption, or an increase in blood volume, or an increase in cardiac output, or an increase in blood pressure. So it could be any of one, or it could be multiple of those. Also, another factor that could be involved is due to an increase in sympathetic nerve activity and due to an increase in heart rate. Also, we might have an increase in total peripheral resistance, where this will literally change the structure of the arteries over time, and especially as we age, our proteins are less elastic, and so going back to normal is a lot more difficult for us. And then lastly, decrease in potassium diets can also increase salt effects on blood pressure. Damage that can occur with hypertension can result in a lot of organ damage as well. And so if we have damage, say, leading to the brain, then we could have a decrease in blood supply there. Also, a common feature that we have associated with hypertension is vision loss due to blood vessels within the retina. Also, in the systemic circuit, there is atherosclerosis, where there is narrowing of the arteries as well. For the heart, it can lead to heart attack due to ventricular overload to eject blood at an abnormal amount. And so within the left ventricle, typically, that's associated with left ventricular hypertrophy, and that's where the heart is again working an overload to try and pump out enough blood to go to the entire system. And then also there is kidney failure that can result due to blood vessel damage within the kidneys. And so we can have an accumulation of waste products that are circulating within the bloodstream. And then as well as with blood or bone loss, where this will increase the amount of calcium within the urine due to working with kidney failure as well. So these two will work together in terms of that damage as well. So some treatments for hypertension include lifestyle changes. So the big thing that your medical provider will prescribe is to decrease the amount of salt intake, because typically the American diet is very high in salt, so that's one easy thing to change. Also limiting smoking and alcoholic drinking to help with the hormone levels, especially with antidiuretic hormone. Also to start losing weight and exercising if that's not part of a daily regimen. Potassium and possibly with calcium supplements tend to be effective in terms of decreasing that loss that occurs. Diuretics help to increase urine formation, so that will also put less stress on the kidneys. Beta blockers help to decrease cardiac rate, so combats that sympathetic nervous activity that we have. And then ACE, which is angiotensin converting enzyme inhibitors, block angiotensin II production for the kidneys, and so that helps with water retaining. So going into shock now, this is when there is an insufficient amount of blood flow that needs to match the oxygen needs of our tissue. And so symptoms can result from a decrease in blood flow, and our circulatory then will adapt and change the amount of blood flowing to certain organs to meet those that are considered to be our necessary and vital organs. And so problems though that can occur at long term is that this can lead to death. So some compensation mechanisms that we have are with the sympathetic nervous system, where this will increase the heart rate and stroke volume, and so it will decrease the blood flow, say, to the digestive tract into skin, so that more blood is going to the heart, is going to the brain, as well as to skeletal muscle. Kidneys, too, can compensate shock by decreasing the amount of urine production, and so this will increase the amount of sodium and water retention by increasing aldosterone and ADH levels. And so we try so that it compensates again for the decrease in blood flow. And this table here is detecting what are different signs of shock. So early signs include with the blood pressure to have a decrease in pulse pressure, but an increase in diastolic pressure. And within the urine, we'll have a decrease in sodium concentration due to sodium retention, but an increase in osmolality because of an increase in water. And then also blood pH will have alkalosis, where we'll have an increase in pH due to hyperventilation and circulating bicarbonate. And then we'll also have a slight restlessness in warm, dry skin, where late signs then will have a decrease in systolic pressure, decrease in urine volume, and going to that of what is like only 400 milliliters. Also, we'll start to have a decrease in pH though, which will combat that of hyperventilation due to the metabolic acid buildup from waste products. And then with the skin, we'll tend to have cold and clammy hands, and then this cloudy sensation. So once individuals get to this point, this is when it's extremely dangerous. And so measures need to be taken to prevent death. Hypovolemic shock is also known as hemorrhagic shock, and this is when somebody loses more than 20% of body fluid or of the blood or fluid loss. And so problems with this is that it makes it difficult for the heart to pump a sufficient amount of blood to the body. And a lot of times this is due to injuries, dehydration, or severe burns, like typically with the type 3 burns. And so what we'll see is a decrease in cardiac output and a decrease in blood pressure. And so the blood then is going to go to the heart and brain at the expense of other organs. So typically like the digestive organs will get a lot less of the blood flow going to it. So immediate compensation mechanisms include the baroreceptor reflex. However, that's going to be on the short term, but that will start to lower blood pressure as well, and then to increase heart rate, increase peripheral resistance, and to produce cold, clammy hands, because again, blood is going to be diverted to the brain and the heart, as well as a low urine output to not have more fluid loss. So septic shock is due to an infection that causes drastic changes to the body and can be very dangerous and life-threatening. And so this is when chemicals that fight infection are triggered by inflammatory reactions due to releases in bloodstreams. And so this can cause inflammation within the body, or it can have an infection that occurs within vital organs such as the heart, the brain, or the kidneys. And then another cause of it is due to a very significant decrease in blood pressure that can lead to respiratory or heart failure, stroke, or failure of other organs, and in extreme cases with death. This is very rare though in terms of what prevalence, though the mortality rates are high for this. Typically with septic shock too, when somebody has very low pressure, they also can't respond to fluid replacement. And so there's very low amounts of urine that are produced. There's like confusion and dizziness, and then also problems with breathing. And then cyanosis can occur where you have actually like a blue tint to your fingers or your lips. And so that's typically a sign that one of the organs are also going into failure. So other causes of shock, though, can be due to severe allergic reactions. And so anaphylactic shock is an example where it's an increase in production of histamine and causes vasodilation, which that will cause a very low blood pressure where it's 30% lower than normal. Another cause of circulatory shock includes spinal cord injury or anesthesia due to loss of sympathetic stimulation, and this is when we have abnormal smooth muscle tone within the blood vessels that causes then a very low blood pressure. And then lastly, cardiac failure due to myocardial loss, where these are with severe heart attacks. And most problems, though, are occurring with systole versus with diastolic conditions. Congestive heart failure occurs when the cardiac output is not sufficient to maintain blood flow requirements for the body. And so these are caused by MIs or myocardial infarctions, where these can be heart attacks and death of heart muscle themselves. And this also can be due to congenital defects, such as like pulmonary valve stenosis. There could be a large overriding of the aorta, or also with right ventricular hypertrophy, which is not as common as with left ventricular hypertrophy, meaning blood flow going into the pulmonary circuit, and so decreasing the amount of oxygenated blood that will come back into the systemic circuit. Also, we can have disturbances in electrolyte levels with potassium and calcium, which would affect then the contractility of the heart as well as with our nerves. And so some of these will be similar to that of like that hemorrhagic or hypovolemic shock in terms of symptoms and responses for what we see with these individuals. And lastly, so there are the types of congestive heart failure. So we have left side failure and right side failure. So the left side failure will be due to left atrial pressures that are increased, and so this is going to produce congestion within the pulmonary circuit and will cause edema within the lungs, thus preventing more fluid around those lungs and causing shortness of breath. Right side failure, this will be when the right atria pressure will produce a congestion within the systemic circuit, and so we'll have pooling of fluids within the extremities, typically within the legs, and so that will cause edema there.